My name is Catherine Kirkland. The date is March 23rd, 2021. Here is my makeshift flashcard. I'm going to be talking today about hyperthyroidism syndrome. So this is basically where the thyroid gland produces too much of a thyroid hormone called thyroxine. This accelerates the metabolism and can cause weight loss, rapid heart rate, and an increased appetite because you're losing weight and your metabolism is acting much faster than it should be. Some other symptoms would be heart palpitations, irritability. It can cause your hands to tremor, can cause sweating, your hair will become more brittle, difficulty sleeping, and it causes differences in your menstrual cycle. Just abnormalities could be longer or shorter than normal, could be longer in between. And this would also cause a goiter in your throat, which is a swelling of the thyroid gland. So several diseases that fall under the umbrella of hyperthyroidism would be Graves' disease, which is an autoimmune disease where the body's immune system attacks the thyroid gland. This is more common in women under the age of 40 and can cause reduced sex drive, sleep disturbance, and what's called Graves' ophthalmopathy, which is basically just different problems with your eyes. It can cause vision loss or even total blindness. It could cause just peripheral vision loss. It can cause all kinds of problems with your eyes. Another disease that is caused by hyperthyroidism would be thyrotoxic myopathy, which is basically an attack on the neuromuscular system, and it can cause your muscles to become fatigued more easily. It can cause pain, and it can also cause rhabdomyolysis, which is a breakdown of the muscle in your body. Another disease that is associated with hyperthyroidism, it actually is one of the causes of hyperthyroidism, but that is thyroiditis, which is a swelling of the thyroid gland. It can also cause hypothyroidism, which is another syndrome in the same category. So hypothyroidism basically causes the opposite symptoms. There's not enough thyroxine circulating, so it can cause sensitivity to cold rather than the heat sensitivity that hyperthyroidism can cause. It causes you to become fatigued more easily, can cause your skin to be more dry, causes you to gain weight, and also causes a goiter in your throat. And basically, you can differentiate hypothyroidism from hyperthyroidism because the levels of thyroid hormones in hypothyroidism are obviously going to be lower. Another syndrome that is in the same category would be Cushing's syndrome, which is excess cortisol production. And it causes high blood pressure, fatigue, can cause diabetes, and usually one of the most common causes of this would be a tumor on the pituitary gland that is causing just that excess cortisol release. And you can tell the difference between that and hyperthyroidism because Cushing's syndrome usually causes weight gain. And again, you would find elevated cortisol levels rather than elevated thyroxine levels. And the last disorder that's in that same category would be polycystic ovarian syndrome. So this causes an increase in androgens in the female body, which is basically male sex hormones in the female body. So that would cause a woman to grow more facial hair like a man, grow more body hair like a man, and can even cause male pattern baldness. And in some severe cases, it can cause severe acne. And obviously, as in the name, it would cause polycystic ovaries, which is where your ovaries are, they have cysts and they become enlarged. So that is my presentation on hyperthyroidism, and I hope you enjoyed.